An inquiry into the government's response to the coronavirus pandemic gets underway today, with the all-party parliamentary group on coronavirus holding its first oral evidence session. Well, joining me now is Dr. Chaand Nagpaul, who's the chair of the British Medical Association Council, and he's giving evidence to that inquiry in a few hours' time. Do you think this inquiry is particularly important? After all, we have had the promise from the Prime Minister that there will be a proper inquiry later on.
Yeah, so what's I think really important about this inquiry, it's termed a sort of a rapid inquiry, so that we can look at the events of the last few months, learn lessons, but most importantly, for this inquiry to come up with recommendations, because we are entering what will be a particularly demanding period on the NHS as we enter winter, because we've got the potential for a flu outbreak, a second spike, plus all the other demands on the NHS, because people are more ill during the winter months, both in terms of respiratory illnesses, but also other problems, including people suffering falls and suffering from the cold weather itself. So it's an important review. It's important it gets underway. It's important it draws its conclusions very soon before we enter winter.
And as the representative of Britain's doctors, what will you be saying?
Well, first of all, we want to make sure that there's proper preparedness in a way that didn't occur first time round. So issues that our members will want to be particularly reassured on is, first of all, making sure we have enough personal protective equipment, because as we enter this new phase, we're going to need much more personal protective equipment than first time round, because we'll be seeing patients with flu who will have symptoms indistinguishable from COVID. Effectively, we will need to be having levels of wearing of PPE at a much greater scale across all settings in the health service. We also want to make sure there's adequate provision of testing, because that was again something in the early months we found wasn't occurring as it should, because if we are to contain and prevent this infection spreading and overwhelming the health service, you need to have in place adequate testing with rapid results. And so, at the moment we're told about an app that is yet to be launched, but we need to make sure we are prepared for all of that. We also need to make sure that there is enough capacity in the NHS. What had to happen first time round in the first peak is that the NHS had to put a halt on its routine services, because it needed to find the capacity for dealing with COVID-19. What we need to do now is make sure the NHS doesn't come to a halt, because we've now accumulated about several million patients who have yet to receive an appointment or receive an operation. And those patients now are on a backlog which we need to clear. But what we mustn't do is create further backlogs by suspending the NHS, as a whole, apart from dealing with COVID. So what we need to do, and what this review should be looking at, and what I'd like to put forward, is a proper plan, so that we have got the capacity to cater for patients who are seriously ill, who need to be seen, alongside what may happen with another outbreak of coronavirus.
It's not just the NHS or other services in the NHS which suffered, is it? Because care homes which are outside the NHS, the push to protect the NHS led to further outbreaks. Can that be prevented from repeating itself?
Absolutely, this is a really important learning point. We must make sure that we don't enter the coming months with a repetition, because one of the problems we had last time is we had shortages of PPE, severe shortages, and that in part was the reason why care homes were not given supplies. We didn't have enough to go around, and that's why it's important that we hear from the government exactly what levels of supplies are available and how they will be able to meet the demands both in the NHS but also in care homes. With regards to patients being discharged without testing, remember we also had problems we didn't have enough capacity for testing earlier on, which is why it's so important that we see proper modelling from the government around what we may see in terms of the levels of testing that are going to be required. And remember that as we enter winter, there'll be normal flu, normal respiratory illnesses, that will mimic the same symptoms of COVID-19. So the volume of testing will have to be much greater. But what we have also learned is you can't separate the NHS and the care home sector and the social care. They are part of the same whole system. And we must make sure that when we approach the coming months, we have to look at both in tandem, and one depends on the other. Because if we have outbreaks within the care home sector, it actually does result in the NHS again having to address that. Patients get readmitted to hospital, they become ill. We must make sure we look after people in the community as part of the entirety of care we provide in the National Health and Social Care Service.
Now, I just want to ask you about one piece of good news. This is coming out of Australia, saying, which of course is in its winter, and they're saying that other diseases, particularly flu, that the incidence is down, and they reckon that's precisely because of social distancing. So if the public keeps it up, it may not just be coronavirus they avoid. Would that be logical?
I mean, there is logic in that. And I think this also highlights how important it is that in addition to all the measures I've talked about, we have continued clear public health messaging about how to prevent spread of viral infection. So that will be both coronavirus, but also, of course, the flu, etc. And why it's important that even measures such as the use of face coverings, what the British Medical Association have said is that we don't see why it's being restricted just to shops and a few settings. It should be everywhere where people are congregating and unable to be 2 meters apart. So taking those measures now will prevent spread, and hopefully that will also, of course, help prevent spread of flu as well. But I think it's important not to be complacent with the example of Australia. We know that these outbreaks occur in a very erratic manner, and we've seen a dramatic change, for example, in Spain, literally within the last 2 to 3 weeks. It's gone from a nation that had only a few hundred new cases to now having over 3,000. So that's why it's important to continue the very clear messaging that whilst we are resuming some normality, it's not normal in normal terms. It has to be normality coupled with proper safeguards of social distancing, wearing of face coverings in all settings, and continuing those other mitigations, for example, in workplaces, which can also spread infection by having barriers and screens. So everyone understands this virus is here, and if we have to be careful to prevent it spreading in a way that overwhelms us in the winter months.
Dr. Nagpaul, thank you for joining us.